Good day, fellow learners. This is your mentor, Ray Gapuz, joining you for discussion on our case number 40. So before we get to start, I'd like to knock in your kind-hearted spirits and heart for this goal. Our goal is to provide free NCLEX RN application and review to 500 nurses. And to help us achieve this, just watch and finish the ads in our videos. And if you share this video to at least 10 of your friends, we will pray for your success. Thank you so much. So before anything else, we'd like to say congratulations to Gazel Paula A. Maribay, Paui for short, USRN from Southeast Asian College, who passed the Board of Nursing in the state of Illinois last March 26, 2025. And of course, her success story, let's share with everyone. God will restore your lost years. Being out of the academe for 14 years is one of the many struggles I faced when I started reviewing for my NCLEX exam. But divine intervention, as I call it, I enrolled myself and put my 100% trust, thank you for the trust, at the Ray Gapuz review system. The review itself is tedious and will definitely drain the energy out of you. But when exam day came, I tasted the sweetness of my hard labor from all the sleepless nights I got myself into. Just to study tons of materials because I got the confidence to ace this exam, knowing I am fully equipped with the right knowledge that I need to answer every question with ease because RAGRS prepared me well. Sir Ray, from the bottom of my heart, thank you. I pray to the Lord to give you more years to live for you to be able to produce more USRNs in the future. I will always remember all the lessons you taught us about the exam and about life in general. I would also like to extend my sincerest gratitude to my BFFs, Miss Joanne and Sir Efren, and to my favorite IT, Sir Eric, for always extending your help whenever I have queries. And to Mentor McLean and Mentor Jimmy, you both spoke to me, to the winner in me, even before I started winning. And for this, I will always be grateful to both of you. Passing NCLEX is my greatest testimony that God gives what my heart desires is in His perfect timing. Good things come to those who never give up. I would like to dedicate this win to my tatang boy, whom I know is the happiest and the proudest dad if he's still here. Tang USR entoy anak mon, that's in Ilocano. I miss you, para ken ka ditoy amok nakaragragsak tatan. Okay, although this will never be possible without mom, I miss you, para ken ka ditoy amok nakaragragsakan. And this also will never be possible without Celia, Manong Edison, and Ading Nina. To Jevi, Melay, Maki, Dayan, Joel, and Crystal, a million thanks to you. And last but not the least, to my baby, I'm giving you half of my trophy, for I know we both work hard on this. You were there at my lowest, but you saw the strength in me that I never thought I had, and you kept me going. Your love and support since day one encouraged me to my greatest potential in passing this exam. I was definitely not an easy journey, but truly the view is sweetest at the top. Thanks for being my rock and my home rolled into one. I truly appreciate the person that you are. I love you above all. Thank you, Mama Mary and Jesus, for giving me this dream, for showering me with endless supply of wisdom, strength, and determination. Most importantly, for fulfilling your promise that I need to do my best and you will do the rest. It was indeed a good fight of faith. So thank you very much, Pawi, for those very inspiring sharing that you gave through your testimonial. So once again, our congratulations from your Ray A. Gapuz system family. Now, let's move on for next generation NCLEX RN case number 40. So we'll talk about multidisciplinary management of a client's condition. Now take note that if we talk about multidisciplinary management of a client's condition, the composition of the multidisciplinary team would definitely depend on two things. One, the diagnosis of the client, and two, the functional deficits that the client may experience because of their diagnosis. So let's begin with our first functional concept. The occupational therapist provides rehabilitation activities for patients with functional deficits in activities of daily living. That means um, activities of daily living that includes feeding oneself or writing down notes, fine motor skills retraining, especially when opening doorknobs or opening bottles, and feeding and handwriting problems. So remember the 3F, functional deficits in ADL, fine motor skills retraining, and feeding and handwriting problems. Now, so if a client with rheumatoid arthritis that has a 1-month-old baby is admitted, you need to refer the client for the rehabilitation of their fine motor skills to an occupational therapist. Next, the physical therapist helps patients regain movement and independence through, remember, WAP, walking aids like crutches, walkers, and canes, assistive device training, and prosthetic or orthotic training if applicable. So which simply means that if you need to assist a client to regain gross motor function, then you need to refer that client to a physical therapist. So once again, fine motor skills for to refer to an occupational therapist, and for gross motor skills, that should be referred to the physical therapist. Now, the orthopedic surgeon performs surgeries to correct musculoskeletal problems, including, remember fast, fracture repair and joint replacement, arthroscopy, that's visualization of a joint or performance of joint surgery, spinal surgeries, and then tendon and ligament repair. Once again, fast, fracture repair, arthroscopy, spinal surgeries, and tendon and ligament repair. Now, the neurologist, on the other hand, evaluates and diagnoses conditions affecting the brain, spinal cord, nerves, and muscles, including, remember, your pains, multiple sclerosis, migraine, Parkinson's disease, Alzheimer's disease, neuropathies, epilepsy, and stroke. So before we try to use the functional concepts to answer a question based on a case study, let me just share with you the good feedback of those who are reading NCLEX RN 311, and that's my book. Okay, so this is the book, NCLEX RN 311. So it comes in full color, okay, and it's available at our Ray Gapuz Review System outlet at the United Nations Avenue. So please text or call our headquarters. So it says parang actual, parang reflection po talaga sir ng quick fix, YouTube, and 311 yung questions that I got. So happy I got through the exam successfully. Patok also came out. I was like, sir, they know what topics would come out. I'm glad I'm a Gapuz baby. And then, halos same po siya sa pagkakakonstruct sa mga na-encounter kong mga standalone questions. So, NCLEX 311 po, the best. Then, sincerely speaking, if it were not for NCLEX 311, I would not have passed. I went through it the last 4 days of the exam. The book is amazing. Keep up the good thing of helping us nurses. Thank you so much. And that's the reason why a 66-year-old, you can ask ChatGPT to validate. She's the oldest NGN passer in the world. Congratulations to Flor Pangilinan Villarier of Ago Foundation College, Naga City, for passing the state board for New York last December 2, 2024. So here we go. Here's case number 40. A 65-year-old stroke survivor who has regained mobility but still struggles with dressing, grooming, and meal preparation should be referred to which member of the multidisciplinary team? Is it 1, physical therapy, 2, neurologist, 3, orthopedic surgeon, 4, occupational therapy? Now, the fact that the client has had stroke and has regained mobility, so it simply means that the gross motor functions is list of the client's concern at the moment. And the gross motor function is covered by a referral to a physical therapist. However, what the client struggles with at this point would be dressing, grooming, and meal preparations, and that would entail fine motor skills. And the fine motor skills is covered by the function of the occupational therapy. So the answer is number 4. Okay. Excellent. So you are also invited to our open house. This is our NGN simulation room, the only one in the world. We're the only one with an NGN simulator. And you can feel free to please visit us at the Ray Gapuz System building in United Nations Avenue in Manila. This is where we conduct our quick fix sessions. And of course, this is where our main review hall is at the fourth floor of the RA Gapuz building. And we pride ourselves in our excellent, clean, and comfortable facilities. So, if you are yet to subscribe, if you have yet to subscribe to my YouTube channel, please join our close to 30,000 subscribers. So if you want to listen to the trends, subscribe to my YouTube channel. So our promo, get a free review from us if you process your NCLEX RN application with ITAPS Gapuz. And of course, we have a low down payment for our NLE review. Join our 316 top notchers with 8 number 1 placers since 1994. For our next gen NCLEX application processing with free review, call us anytime. And if you want unlimited next gen NCLEX comprehensive review at 8,800, please text or call our number 0906-201-9383. So once again, this is your mentor, your fact check buddy Ray Gapuz. Until our next video. Until then, good luck and God bless to those who are about to take the test.